9 easy ways to lower triglycerides naturally. Number 1. Lose weight. Losing weight not only decreases stored body fat, but also reduces serum triglycerides. One study looked at 401 overweight adults enrolled in a weight loss program. By the end of the study, adults who lost 5 to 10% of body weight had significantly lower triglycerides. Those who lost over 10% had even more significant results. Another study looked at people who gained weight back after losing it. Even so, these folks maintained reductions in both triglycerides and total cholesterol. How does shedding pounds reduce triglycerides? Well, losing weight improves blood sugar and insulin levels, which means fewer triglycerides are made by the liver. Lower blood sugar, lower triglycerides. Obesity is also a major risk factor for heart disease. Losing extra weight is good for the heart. Healthy weight loss means losing fat, not muscle. To do so, make sure you eat enough protein and lift weights. Number 2, cut your sugar intake. If the standard American diet, SAD, is high in anything, it's high in sugar. That's right. The average American eats about 152 pounds of sugar every year. Added sugar comes from sweetened drinks, baked goods, candy, desserts, almost anything that comes in a package. That includes the purple Kool-Aid at the gas station. And yes, added sugar in the diet means added sugar in the blood. Your liver then turns that sugar to triglycerides. It's a safety mechanism, if you recall, to prevent dangerous hyperglycemia. Those triglycerides, unfortunately, end up as body fat, in your gut or thighs, or visceral fat around your organs. They also end up in your blood, where you can measure them. In one study, researchers found that fructose and high fructose corn syrup significantly increased triglyceride levels in young men and women for 24 hours following ingestion. After 24 hours, however, the serum triglycerides returned to baseline. Where did all those triglycerides go? They were probably stored away. Another study found that sugar intake was linked to higher triglyceride levels in children. Low-carb, low-sugar diets, on the other hand, are linked to lower triglyceride levels. More on that now. Number 3, consider going keto. It seems counterintuitive, but eating a high-fat diet can lower triglycerides. Wait, hold on. Eating fat lowers the amount of fat circulating in your blood? It can. The reason, again, involves your metabolism. Here's the thing. Having high triglycerides is linked to obesity, low HDL cholesterol, high blood sugar, high insulin, insulin resistance. In other words, high triglycerides are linked to metabolic syndrome, the extreme version of which is type 2 diabetes. In many cases, these metabolic issues stem from high-carb diets. Nothing raises blood sugar, insulin, and triglyceride levels like soft drinks, ice cream, cookies, crackers, chips, donuts. Well, you get the idea. Enter the high-fat, low-carb ketogenic diet. It's been shown to have positive impacts on all these metrics. The keto diet, in fact, is a promising therapy to reverse type 2 diabetes. Some published evidence now. One group of researchers put 83 obese patients on a 24-week ketogenic diet. The results were positive: lower triglycerides, lower blood glucose, lower LDL cholesterol, and higher HDL cholesterol. In another study, a 12-week keto diet decreased triglyceride levels in men by 38.6%. These men, by the way, also lost 20% of their abdominal fat. One final point. Be sure to avoid trans fats on your ketogenic diet, as these have been shown to increase triglycerides and heart disease risk. Saturated fats and monounsaturated fats should comprise the bulk of your fat calories. Eating monounsaturated fats, like olive oil, are linked to reduced cardiovascular disease risk. Number 4, consume fiber. Dietary fiber has many health benefits. Eating fiber feeds your gut bacteria, which then produce anti-inflammatory short-chain fatty acids (SCFAs). Increases satiety. Limits blood sugar spikes. Supports the immune system. Helps prevent diabetes. Keeps the bowels regular. Binds to toxins in the stool. Consuming fiber may also lower triglycerides. Take the BioCycle study, which followed 259 women for up to 2 menstrual cycles. Researchers found that women who consumed over 22 grams of fiber per day had lower total cholesterol, LDL cholesterol, and triglycerides. According to another paper, eating more fiber may also limit the triglyceride impact from a low-fat, high-carb diet. Other research, however, has found no impact of dietary fiber, soluble fiber, to be exact, on triglyceride levels. High-fiber foods include broccoli, root vegetables, avocados, carrots, sweet potatoes, and asparagus. The most plant matter is high in fiber. The takeaway is that fiber may lower triglycerides. More research is needed though. Number 6. Get omega-3 fatty acids. The omega-3 fatty acids EPA and DHA are considered essential fatty acids because you must get them through diet. These polyunsaturated fats are crucial for brain health, controlling inflammation, and, recent research suggests, heart health too. That research was called the REDUCE-IT trial, a 5-year, randomized, double-blind, placebo-controlled trial on 8,179 high-risk heart disease patients. Patients with elevated triglyceride levels are at increased risk for ischemic events, state the authors to begin the paper. The omega-3 fatty acid EPA is known to lower triglycerides, they continue, but actual effects on heart disease are unknown. The study design was simple. Half the patients received 4 grams EPA per day, the other half received a placebo. The primary endpoint was a composite score of cardiac death, heart attack, and related events. The results were significant. Compared to placebo, there were fewer cardiac events in the omega-3 group. To get your omega-3s, eat fatty fish like salmon or sardines. That's the most natural way. Alternatively, you can also take a high-quality fish oil supplement. Just be sure to check with your doctor, as high-dose fish oil can increase bleeding risk. Number 7. Exercise. Exercise is amazing medicine, but you need to put the work in. They haven't made an exercise pill yet. Physical activity appears to moderately lower triglycerides. The mechanism involves an enzyme called lipoprotein lipase, or LPL. Think of LPL as your fat-busting chief. It busts up your triglycerides to be used for energy. Simply put, exercise stimulates LPL, and LPL breaks up your triglycerides. Good deal. Number 8. Limit alcohol. Heavy drinking is linked to all sorts of negative conditions, heart disease, alcoholic fatty liver disease, and pancreatitis, to name a few. Here's another reason to avoid heavy drinking. Like sugar, alcohol can be converted, by the liver, to triglycerides. Oddly enough, light to moderate alcohol consumption is associated with decreased triglycerides, possibly due to polyphenols in wine and individual genetic factors. But if you have very high triglycerides, experts recommend you cease drinking alcohol entirely. Number 9. Intermittent fasting. Intermittent fasting, is the regular practice of not eating. Intermittent fasts can range from 12 hours to several days in length. Here's what happens. When you fast, your body stops burning sugar, and starts burning fat, for energy. It is similar to the keto diet. In both fasted and ketogenic states, you mobilize body fat to make ketones. These ketones are used, instead of glucose, for energy. Back to triglycerides now. Alternate day 24-hour fasting has been shown to promote weight loss, lower cholesterol, and lower triglycerides. All favorable changes for heart disease risk. The takeaway on triglycerides. Triglycerides are bundles of fat, perfect for energy storage. You need them to function normally. High triglycerides, however, are correlated with increased heart disease risk. To lower triglycerides naturally, focus on diet and lifestyle. Going low carb, getting enough omega-3s, exercising, and limiting sugar all can help. And the best part, these changes don't only improve your triglycerides, they also improve your health.